Lung Infections in Cystic Fibrosis Patients by Emely and Amber. Cystic fibrosis is a life-threatening genetically inherited disease that causes the secretion of too much mucus in the lungs and digestive system. The gene is passed down from parents who both carry the gene. Carrier parents have a 1 in 4 chance of having a child with cystic fibrosis. The defective gene creates symptoms such as constant coughing, wheezing, poor growth, and frequent lung infections. The buildup of mucus in the lungs creates a breeding ground for bacterial infections, which over time leads to respiratory failure. As for the digestive system, the mucus blocks enzymes that break down food and absorb nutrients, which is why cystic fibrosis patients may be smaller than their peers. Here is a visual representation of what cystic fibrosis does to the airways. Above is a normal, healthy airway with a thin layer of mucus. Below is an airway of a cystic fibrosis patient with a thick, sticky layer of mucus. Pseudomonas aeruginosa is one of the most predominant lung pathogens in a cystic fibrosis patient. It is considered an opportunistic pathogen, commonly found in nature, water, and places with warm moisture. It is not known to frequently cause disease in a healthy host, but it can be deadly for immunocompromised people such as ones with cystic fibrosis. The organism can grow aerobically or anaerobically and adapts well to different environmental conditions. This is why it is so dangerous to CF patients. Treatment includes percussion therapy, which uses vibrations to break up the mucus and clear the airways through coughing. There are antibiotics for this infection, however, antibiotic resistance is becoming a big problem for this organism. Methicillin-resistant Staphylococcus aureus, also known as MRSA, is another dangerous bacteria that worsens lung infections in CF patients. It infects the skin and lungs and is resistant to several antibiotics. MRSA can be spread from person-to-person contact and by respiratory droplets. According to a 2010 study in the Journal of the American Medical Association, researchers found that having MRSA in a CF patient's lungs for more than 2 years can directly affect their survival. The infection can be diagnosed through sputum samples in the lab. Sputum is a substance composed of mucus and saliva from the respiratory tract that CF patients cough up. Treatment for this bacteria is becoming increasingly difficult due to its resistance to common antibiotics. There are several steps a cystic fibrosis patient can take on a daily basis to treat and prevent bacterial infections. Daily percussion therapy is done to break up mucus within the lining of the lungs in an attempt to thin the biofilm within the lungs and make it more difficult for opportunistic pathogens to settle in the lungs. Daily inhaled antibiotic treatments, such as vaporized breathing treatments with antibiotic medications like tobramycin, are taken multiple times per day to combat the bacteria within the lungs. CF patients are hospitalized approximately every 3 weeks for a minimum of 2 weeks or more to be given antibiotics orally or through an IV. This also allows them to be under close supervision by the hospital staff. Since CF patients are prone to opportunistic infections, they are constantly taking antibiotics. To reduce their resistance to antibiotics, they change medications every other month. In severe cases of organ failure due to bad bacterial infection or complete blockage due to mucus, CF patients will undergo organ transplants. After organ transplants, they are cured from any and all bacterial infections due to having no biofilm. Eventually, their transplanted organs will gain a biofilm and will be back to square one. But with preventative treatments and procedures, this can be mitigated for a long time. The top left picture shows the inside of a CF patient's lungs. The bottom left picture shows lungs removed from a double lung recipient. On the right are perfectly healthy lungs. The left picture is a child doing his vaporized antibiotic breathing treatment paired with percussion therapy through the vest he is wearing. To the right is a child in a hospital receiving her vaporized antibiotic treatment. The nurse is fully gowned up and wearing gloves to prevent the spread of any opportunistic bacterial infection.